Good morning and welcome to the Tasmanian Chamber of Commerce and Industry presentation on how to conduct a COVID-19 risk assessment. I begin today by acknowledging the traditional custodians of the land on which we gather today and pay my respects to their elders past, present and emerging. I extend that respect to Aboriginal and Torres Strait Islander peoples here today. Most businesses at the moment are asking why we have to conduct a COVID-19 risk assessment. It's the responsibility of the person conducting the business or undertaking to identify and control risks. Employers, under the Work Health and Safety Act and public health directions, must undertake a COVID-19 risk assessment. And ultimately, workers have a right to work in a safe workplace. Before we talk about how to do a risk assessment, let's first explain what a hazard and risk are. A hazard is an object or condition with the potential to harm life, health, property, and/or the environment. For example, biological viruses, including COVID-19. Risk is the combination of the likelihood of an unwanted event occurring and the consequence of that event. In order for us to manage the hazards and risks in our workplaces, we need to work through a risk management process. And while we do this, it's vital to remember to consult with your workers through each stage. As listed on the slide, the process is firstly to identify the hazards, assess the risk, control the risk, and then review the control measures. You will also need to consider what is reasonably practicable while determining control measures and take into account the likelihood of the hazard or risk occurring, the degree of harm from the hazard or risk, knowledge about ways of eliminating or minimising the hazard or risk, and the availability and suitability of ways to eliminate or minimise the risk cost. Risk assessments ensure you are able to identify all hazards in the workplace, and in this case hazards related to COVID-19. A risk assessment is the process used to determine the level of risk of injury or illness associated with the identified hazard. Once the hazard has been risk assessed, control measures should be applied to reduce the risk to an acceptable level. Risk assessments are highly important as they can assist to create an awareness of the hazards and risks in your workplace, identify who may be at risk, and determine whether there are existing and adequate control measures in place. The first step in the risk management process is to identify the hazard. Thoroughly assess the workplace to identify hazards, both existing and potential, and remember to consult with your employees throughout this stage. Identify the risk to your workers, the risk to your customers and your business service, the risk to contractors and visitors entering your workplace, and risk to the continuity of your business. Step 2, assess the risks. Once the hazards have been identified, the degree of risk they present needs to be determined. This entails preempting how these hazards can cause potential injury in different situations and conditions. You should consider how likely it is that someone will be harmed and how serious the resulting injury may be. In this stage, we should also consider if the current control measures the business have in effect are reducing risk. We do this by using a risk matrix, which is a tool that is normally used to assess the level of risk and assist the decision-making process. It takes into consideration the likelihood against the severity of the consequence. Once you have identified the hazard, you must assess the level of consequence or how serious the resulting injury may be. For example, if a worker in your workplace was to be exposed to COVID-19 and they had been vaccinated, the consequence may be minor, but if they were not vaccinated, the consequence could be major or catastrophic. This table shows an example of the combination of consequence and risk and allows you to determine the risk rating. Referring back to our previous example of a worker who is exposed to COVID-19 and they are vaccinated, the consequence was minor and the likelihood at the moment in Hobart is possible. This would make the risk rating medium. If we look at an example of a worker who is not vaccinated and they are exposed to COVID, the consequence is major and the likelihood is again possible. The risk rating would then be high. After conducting a thorough assessment of the risk, you should then look at processes to eliminate or reduce the risk as much as possible. This brings us to step number 3, control the risk. Use the hierarchy of control measures to do this. It starts with eliminating as the first option and works through the different options to the lowest control, which is personal protective equipment or PPE. And remember to consider what's reasonably practicable. Step 4 of the risk management process is monitor and review. Employers need to review hazards and controls to ensure they are working as planned. We need to review and monitor if a new or changed risk arises from COVID-19, for example, customer aggression, high work demand, or working in isolation. If consultation indicates a review is necessary or a health and safety representative requests a review, we must conduct one. The next 2 slides are examples of risk assessments. You will note that the hazard/risk is identified. The consequences and likelihood in this slide have been identified before controls have been put in place and after. You will also note that once the controls have been put in place, the risk rating is reduced. In this risk assessment example, you will note that the hazard has been identified, the likelihood and consequence identified, controls are listed, but there is only a risk rating after controls have been put in place. Vaccinations, understandably, are a big topic at the moment, and there are a number of key factors to keep in mind when discussing them with your workers. Communicate, encourage and support your employees and provide them with access to reliable and accurate information about the vaccine and where they can get vaccinated. Assist your employees to get vaccinated. Be flexible where possible and support them to get the vaccine by offering them time off or swapping shifts. Have sensible conversations with your workplace if you are considering mandating vaccinations. Keep accurate and up-to-date records. Employers can legally ask staff about their vaccination status, though it's up to the individual to share that information or not. Employers should be aware of their obligations under privacy laws. And lastly, continue to take preventative measures to ensure the health and safety of everyone in the workplace, as is your legal work health and safety obligation. If you are considering mandating vaccinations in your workplace, this will depend on the particular circumstances of employment and needs to be assessed on a case-by-case basis. Employers will need to determine the current risk by undertaking a risk assessment and determine if COVID-19 vaccines are a reasonably practicable control measure for the workplace. Refer to the Workplace Employer Guide on the Tasmanian Chamber of Commerce and Industry website for more information on this. And remember, consultation with your workers is a key requirement throughout this process. While undertaking your risk assessment, factors to consider include current public health orders or directions. Are vaccinations recommended for workers in your industry? And will they be exposed to the risk of infection as part of their work? Do your workers work with people who would be vulnerable to severe disease if they contacted COVID-19? And what's the likelihood that COVID-19 could spread in your workplace? Do your workers interact with large numbers and could they contribute to a super spreading event? What are your other existing control measures and do they minimise the risk of infection so far as is reasonably practicable? If you were to mandate vaccinations in your workplace, would the requirement be unlawful and potentially discriminatory? In summary, employers have a duty under work health and safety laws to eliminate, or if that's not reasonably practicable, to minimise the risk of COVID-19 in your workplace. Employers must consult, cooperate and coordinate with workers and health and safety representatives in the workplace about COVID-19 and relevant control measures, including the vaccine. Review and update your COVID-19 safety plan and complete a COVID-19 risk assessment. Monitor, observe and follow directions from public health And lastly, if you have any concerns or queries in regards to COVID-19 or need any support, please contact the Tasmanian Chamber of Commerce and Industry. If you have any questions in relation to this presentation or in relation to anything related to COVID-19 or work health and safety, please send them to hr@tcci.com.au. Please find a list of key contacts and resources for your information. And we would like to thank you for attending the Tasmanian Chamber of Commerce and Industry presentation on how to conduct a COVID-19 risk assessment. Thank you.